One of the first transformative initiatives we undertook as the Maternal, Child and Youth Health Strategy in Ontario was to create the Provincial Council for Maternal and Child Health. This was, for the first time in Ontario, bringing together around one table leaders that ranged in discipline from infertility, fertility and preconception, all the way through to successful transition to adulthood. I challenged them to produce policy advice that would provide a set of actionable recommendations, and I promised to them that we would action 80% of those recommendations within 18 months of delivery to the Ministry of Health and Long-Term Care. After we set the table, after we laid out our vision, after we challenged the providers in Ontario to make Ontario the healthiest jurisdiction in the world to give birth and grow up, and we formed the Provincial Council for Maternal and Child Health, I promised to them that their first piece of policy work, if it came with sensitive recommendations, that I would execute 80% of their recommendations in 18 months or less. The first piece of policy work or policy recommendations that they brought forward were related to the implementation of province-wide fetal fibronectin testing. Fetal fibronectin testing is a test that you can do for a woman who's experiencing symptoms of premature labor, and it will predict with a high degree of sensitivity and specificity the likelihood that she will give birth in the next 7 days. Within not 18 months, but 9 months of the instigation of that policy work, the recommendations were developed, educational materials to accompany those recommendations were developed, the costing model and cost savings implications attached to that model had all been designed, and as of January 1, 2010, every single hospital in the province of Ontario that offers maternity services now has full funding to provide this service for Ontario's women.